epidemic in this world. And you know what it is?
What's the epidemic?
Anorexia Ozempica. I kid you not. It's like medically induced appetite suppression. It's like chemical starvation. People are taking these GLP-1 drugs to the next level, and it's like a very significant misuse. It's almost like enabling an eating disorder. Have you noticed this in your patients?
Yeah, I'm noticing it not only in my patients, but all over society, in people that I know. It's, it's basically now making biochemical eating disorder possible.
Yeah. I mean,
It's taking it beyond weight loss to drug-induced malnutrition.
yeah. Anorexia Ozempica. Let's talk about what it's not. This is not anorexia nervosa. This is not a psychiatric disorder. This is a medically induced eating disorder that I think is a giant problem that I'm seeing article after article, podcast after podcast about celebrities talking about how they're misusing these drugs and they don't have any medical indication for them, and they're getting access to them through the internet. I mean, this is a crazy, crazy problem.
It's it's a system that has now bypassed all the medical safeguards that we normally have in this society, where if you wanted to get on a prescription drug, you'd have to see a doctor. There would have to be some reasonable indication for it. There would be someone monitoring what you're doing. This is just literally going on a website or going in the gray market and just buying these things that are potentially dangerous medications, and people are just using them as they see fit. These drugs aren't designed for you to lose 5 pounds. They're designed to treat diabetes and for major weight loss in people who are obese.
Right, but let's first make a statement like this. I think this is among, if not the most significant medical breakthrough in the history of medicine. These drugs are amazing. It's not the drugs that are the problem. It's the rampant misuse of these drugs that are the problem. Don't you agree?
Yeah, absolutely. I mean, that's like most drugs, really. It's like someone taking a blood pressure drug because they don't want to be 120 over 80, they want to be 100 over 60. It's not what the drug is designed to do, and it's never been tested for these things the way people are using it.
Right. It's like we're going back in time to the early 2000s when extreme thinness was a thing. Remember that? It was like the thinner you are, the better it is, when in fact, extreme thinness is actually a metabolic disorder in and of itself.
It's not healthy. In other words, people are taking a drug that's designed to improve your health and that are amazing for improving health when they're used properly, and using it in a state where they're already healthy to drive them to a point where they're no longer healthy.
By the way, it's having the opposite effect. It's actually making you look older. Okay. It's actually giving you fatigue. It's giving you electrolyte disorders. You're losing muscle and bone. But actually, let's get a little bit not nerdy, but a slightly doctory for a minute and talk about the problem with the misuse of these drugs. Okay, because when they're used properly and you maintain your muscle mass, they cure metabolic disorders. Okay, they're fabulous for obesity. They're fabulous for all sorts of indications. But when used in the way that I'm seeing it with this anorexia Ozempica, this is the fundamental problem I'm seeing. You lose muscle mass, the most important structural component of the body. And when you lose muscle mass, what happens is your metabolic rate goes down, right? And so as your metabolic rate goes down, then your body goes into this conservation adaptation mode where it's basically adapting to starvation. And that leads to a whole bunch of problems in and of itself.
It leads to both short-term and long-term problems. I mean, short-term, these people are walking around probably dehydrated,
Right.
at least acutely malnourished. They're not
Yep.
getting adequate, because it's very hard when you're using these medications this way to take in adequate calories every day because really these people are not meant to be. These are not obese people. They should not be living on, say, 1,000 calories or less per day. But it can be a challenge to get in, depending if you're man, woman, what size you are. I don't know, 1,500 to 2,200 calories. It can be difficult on these medications.
Practical examples of this. There, do you know who Brooks Nader is?
The model,
Yeah.
swimsuit
So
model, yeah.
yeah, so very attractive, okay, but actually talked a lot about the fact that she was using and abusing these drugs to the point where she was throwing up, she was fatigued, I think she passed out, and furthermore, it leads to thinning of the hair, electrolyte disorders, you can't sleep, hormonal disruptions.
Dry, flaky skin, all kinds of things that, aside from the health issues, are just unattractive.
Yeah, menstruation problems. I mean, this is a disaster phenomenon that no one